Welcome San Antonio, I'm Carla Macias, and let's kick off another episode of the Best Docs Network featuring Forest Park Medical Center, your destination to better health. Forest Park Medical Center strives to bring the best of the best to your community, like urologist Dr. Juan Reyna is going to talk to us about the urology group here in San Antonio.
Urology San Antonio is a big believer in diversity, and we really try and cater to the needs of the community. In the city of San Antonio, you have to have Spanish-speaking doctors. In the market that we have to have women in our practice to take care of women that demand women. We have grown our group in several different specialty areas that have made us quite unique, whether they be from robotic surgery, all the way down to infertility and microvascular surgery that our infertility doctors do. We specialize in the area of advanced female reconstructive surgery, advanced male urethral surgery. We have a unique urodynamics laboratory, which is a very high-end way of evaluating bladders that are dysfunctional and can help us make decisions on how to treat patients and when to operate and when not to. And I think in picking the surgeon who's going to give the best, highest quality, least invasive operation for our patients is a guy you want to pick. And we feel free to do that within the group. We inter-refer within Urology San Antonio, and in that area we are unique. We don't feel like we need to be the guy that does everything. We find that individual within our group who's best at doing that particular kind of surgery. We have also developed this partnership with Forest Park. And we find this to be a very exciting new development for us. It provides us with the ability to essentially be able to create our own area of specialty within a hospital, and rather than have to adjust to what the hospital has provided us, the hospital will actually order the things that we think are going to be best to care for our patients. The Forest Park people have been very generous in terms of their wanting to learn about urology. And we have a significant number of our surgeons that are Forest Park partners. We think that the future for a lot of groups is going to be in developing these kind of relationships with hospitals. And Forest Park has been very unique in that regard.
Kelsey has a question for Dr. Jose Barrera. What can be done to improve skin texture and give me a more youthful look?
Skin texture can be improved with fillers. It can also be improved with laser surgery or laser resurfacing. We have minimally invasive tools now that do not require surgery, that are in-office procedures that can be done over a lunchtime or lunchtime hour. And so in the normal doctor's visit, we can offer patients different treatments that can provide a more youthful appearance right away.
Did you know Forest Park Medical Centers utilize a paging system similar to those found in many restaurants today? The paging system notifies patients' family members as to their location and status while undergoing surgery at Forest Park. The system also allows the surgeon to contact the family members to update them on their loved one's surgery.
Forest Park Medical Center strives to provide their patients with the ultimate care as well as nutrition. Let's check out what meals Forest Park Frisco is cooking and what we have to look forward to here in San Antonio.
One great thing about Forest Park is that they include the dining aspect or the food aspect as far as the patient care. Not only do they have great dietitians on site to make sure that the dietary needs are met for the patients, but they also consider the patient's family's needs as well. Let's face it, sometimes you're in a hospital, this facility, 6-7 hours, if not longer, sometimes overnight, sometimes 2 or 3 days. And it's not the typical food. We do everything from scratch, which means that we do everything from the starting point all the way to the finished product. We do pork tenderloin, we do roasted chickens, we do gourmet pizzas. We even do some things similar like grandma's meatloaf, but everything's made from scratch. We follow recipes, nothing comes out of a can. Our sauces are all made from scratch. When you walk into our dining facility here, name is Cafe 114, it feels like a real cafe. You don't walk into it and it's the old type of tray line service here. Every single day the menu changes. So for example, one day you may have a carving station with a prime rib on it, and the next day on that carving station may be a baked potato bar, and the plate itself is a work of art. It's just not something that's piled on the plate and sent to the guest or sent to the patient. It's a work of art because, you know, you may not always come in here where you just on a clear liquid diet. You can actually have surgery where you can eat regular food. So we have to take those cases and we want them to feel like, you know what, this is unbelievable. This is not hospital food. We don't ever want to be stereotyped or categorized as hospital food. We are a cafe dining facility. You can get fresh grilled salmon. We have fresh tuna here. We have a fish of the week. We have grilled pork chops you can get, grilled chicken. Along with that, you can have that grilled, make your salad, give it to one of my grill cooks, and we'll put it on the salad for you. It really starts with Chef Jason Douglas. This guy is absolutely amazing when it comes to food. He is truly an artist when it comes to the culinary aspect of it. He has an eye for making your food look so pretty and edible at the same time that you don't want to touch it because it looks so great. That's one element about dining service I don't have to worry about because I know when he's there that the guests, our patients, are going to get the absolute best that he has to offer every single day. So what we try to do is we try to be innovative with our food, very cost effective, but most importantly, we want a great quality of food. I have this saying that if it's not done in the spirit of excellence, we won't serve it.
Well, it's a culture of caring, and that comes down to the people that occupy the buildings and use the technology, the wonderful processes that we've developed for them. But people really make the difference. For Forest Park, we look for people that have got great experience and great skills, but we're also looking for people that are passionate about what they do, that are compassionate, empathetic people, great nurses, great respiratory therapists, great imaging staff. The greeter at our front desk is warm and bright and welcoming, and she smiles. And even if you come in and you're uncertain and scared and she's the first face that you see, you will immediately melt your fears away because of the engagement. Just the smile and the compassion that comes through. And it's not something you can put on. It's an empathy that people have or don't have. It's one of the traits that we seek. It's a passion about what they do. It's an excellence, it's an attitude. And it's every single person. And so we look for that, we search for it. It's not always easy to find, but when you've got it, every single person that goes into the patient's room, from our environmental services folks, all the way through the clinical team, everybody knows what their job is. They know they're an integral part of the team. And our environmental folks are the front line of our infection control. Their role is incredibly important. It makes a difference in our care, and how they carry themselves throughout their day and present themselves to our patients is very important. And it's all about being compassionate, smiling, being optimistic. In Southlake, we built our team of 150 people over a relatively short period of time. When you're opening a new facility, the wonderful opportunity you have is you get to build that culture. It's not there yet. There's not a culture there. There's a culture for the organization, but when you build that hospital and every single person that you hire, you have to be very careful and selective that you're hiring people that are of the culture of caring, compassion, excellence that you really want to continue for Forest Park. So we're creating more than just excellent healthcare outcomes, we're creating memories, which is a strange way to think about what we do. We're healing people, and those are tasks, and it's clinical, but we're also creating potentially memories, experiences for people that they're gonna talk about and remember. And we want to create an experience that is memorable in every possible good way. And that has to do, again, with our people. How were they treated? Beyond the clinical care and experience, the outcome is excellent. But the thing that's memorable to people is not necessarily how I was put to sleep in anesthesia. It's going to be about how was I treated as a person? Did I walk away feeling like the patient that told me she feels like a princess and this place is like a spa? They had an experience, and that's what they will remember. It's the Disney of healthcare.
Best Docs Network featuring Forest Park Medical Center. Welcome to the 21st century of cutting-edge medicine. Forest Park Medical Center.
Dr. LeRoy Jones is a renowned urologist here in the San Antonio area. Now let's hear his methods on practicing medicine.
I like to practice medicine, using a lot of the current technology. I like to practice a lot of what we call evidence-based practices and things that are proven. I don't like to deviate from the standard of care. So that's sort of, I describe myself trying to stay current on the literature for the conditions that I treat, and in that manner. Our philosophy here at our center is to give guys an environment that they feel secure and privacy is respected, but then also that they're going to receive the latest treatment, and then also have good follow-up with them on our therapy that we recommend to them. So I think communication is very important for patient care as well as education.
From staff to surgeons to technology and technique, Forest Park Medical Center brings the best to your area. For more information, log on to our website, bestdocsnetwork.com, and click on that Forest Park Medical Center tab. Now on to our next best doc, urologist Dr. Christopher Cantrill.
I had been experiencing an unremitting series of bladder infections for almost a year, and I was feeling really uncomfortable and was not responding to the medications that were being offered to me by an OBGYN, and I was feeling really frustrated. And finally, it was suggested that I go see a urologist.
When she first came to see me, she was having a lot of problems with what she thought was recurrent urinary tract infection. They were finding blood in her urine. She was having to go to the bathroom quite frequently and having pain with urination. And given that she'd had so many problems, we end up starting to look for more other reasons as to why people are having these infections. And in the clinic, I was able to look inside of her bladder, and I saw a small tumor growing inside of her bladder, or at least a mass that appeared to be like a bladder cancer.
He told me what was going to happen, and we tried a procedure and thought it had worked, and actually I had to go back a second time.
Unfortunately for Carol, we looked back in 3 months later and her tumor had recurred, which confirmed my concerns that this tumor was coming from the tube draining her kidney.
He checked again at several months later and wasn't totally happy and decided he wanted to do some reconstruction work. And I was glad. If we were going to do it, I wanted it to be right.
Whenever we're doing surgery for cancers like Carol's of the ureter, the goal for us is to try and save as much of her kidney as we possibly can. Well, her tumor was isolated just in the lower portion of her ureter, and I felt fairly confident if we would be able to just take that portion of the drainage tube out, I could save the rest of her kidney and take her ureter and reimplant that into the bladder to allow her to keep her kidney.
When he did the reconstruction of the bladder, he was able to preserve the bladder enough of a percentage of it that I am fine, and I am very grateful for that. Very grateful.
We're groundbreaking for Forest Park Medical Center here in San Antonio. It's a new 54-bed facility here in San Antonio. And I think the outstanding piece of this is just the quality of care that we can bring to San Antonio. For the insured patient here, it's just going to be outstanding. The quality of care that Forest Park offers, as you know, this is the 5th facility that Forest Park will offer. We have a facility in Dallas and Frisco. We're about to open in South Lake. You know, I personally think that it's the quality of care that sets Forest Park apart from our competitors here in San Antonio.
The greatest thing about Forest Park, really, to be honest with y'all, is the people in this room and the people that we touch have an opportunity to secure their own future. And when you travel around the rest of the world and you see how healthcare exists, you kind of have a future, a vision of what's going to happen to us in the United States. There's going to be a healthcare system for the vast majority of people, and those who want something different need to have someplace else to go. And we need to have physicians to treat those people who want to have someplace else to go. And those physicians are in this room. And we have an opportunity to affect very positively on the healthcare for the future and the way we take care of patients. In addition, we also have the opportunity to secure the future of ourselves, our practices, and also that of our families. We all believe in excellence. We all believe in delivering the best healthcare at the best possible price in the best environment to our patients. And we want to make sure that our families have a place, our friends have a place, and our patients have a place that we think is as good as the place that we want to live in. Thank you very much for being here, and we look forward to this hospital.
Each Forest Park facility is very unique. There are currently 3 facilities open in Texas. The largest facility is in Dallas. The second facility was opened in Frisco, which is in the North Dallas area, and the third one in Southlake, which is near the DFW airport. Each facility is unique and different, and a lot of that is because of the makeup of the physicians that are participating with Forest Park in each community. The mix of physicians is unique, the services provided is unique. It's tailored to the needs of the physician and medical community in each city. Each facility is stunning. They look like 5-star hotels. They're beautiful. The physicians now have an opportunity to take their patients to a facility that focuses on quality care and quality outcomes for their patients in a beautiful setting.
One of the priorities that we have as an office, as family physicians, is to associate ourselves with the best hospital delivery systems in the city. And I feel, and my organization feel, that Forest Park represents that for the city of San Antonio.
This is the opportunity to give patients the exact care I'd want for myself, for my wife, for my children, and do it in a setting that they will find charming, relaxing, and restful, which we can't always say about trips to the hospital.
I was very excited to be approached by Forest Park to be part of this organization because they really care about quality. They really care about getting the best possible people involved so that they appreciate a proper assessment of patients so that they can do the right job in that OR suite. Their nurse to physician ratio for those patients who are in the hospital, phenomenal. No other institution has anything like that. I'm really looking forward to working with them here in San Antonio because this is premier medicine at its best, where you can really do what's in the best interest of the patient without interference from outside sources.
I think the idea of having a hospital run by doctors is a good one. I think that you commonly hear complaints by doctors that the rules are made by people who don't understand what happens in a hospital or what happens with caring for patients. And I think that with this model, you're going to have physicians who are able to help fix those kinds of problems. And I think it's going to make not only for a better patient experience, but for better patient safety.
So it's an honor for me to associate my organization to Forest Park organization because I believe that in San Antonio, in the hospital system, with the name and the quality of what Forest Park is creating, is needed for our patients. And to be successful, primary care physicians have to partner with the best hospitals in town. And Forest Park, in my opinion, going to be one of those organizations.
I think what makes Forest Park unique and different is truly the culture that we have. A lot of places present that they have the patient care and the employee satisfaction in their culture, but when you walk into Forest Park, you feel the difference. Our directors over our units are very passionate about what we do, and since we're a physician-owned facility, the physicians that are here are very involved in the care and in the decisions that we make down to the inpatient level.
One thing I really love about Forest Park, and I tell everyone that I
that I talk with in my nursing career about Forest Park. I like to talk about the camaraderie that's here. I really enjoy just a positive, energetic setting with the staff. Everyone works quite well together. Interdepartment, just, you know, pharmacy, ER, X-ray, the doctors, the nurses. It's just a really cohesive unit, and I really enjoy that. And I feel like every day I come here, I enjoy my day. And that says a lot because nursing can be really stressful. So to be able to come here and feel the support from my teammates and to have a good day at the end of every day is something I really appreciate.
The best thing about working at Forest Park is that we are a family here. All the directors know each other. We know each other inside and outside of the hospital. We know how to work well with each other. And our administration here at Forest Park really appreciates and shows us how much they appreciate us, not in big ways, but in small ways every day that really make the difference in a place where you want to work.
One thing that really stood out about Forest Park was just the quality of patient care and just the way that the patients are treated, the entire, not only high level of patient care that's delivered, but also the entire experience that they receive here. The facility promotes patient satisfaction, patient care, which are all things that are very important to me, and it's a facility that I feel like I'm very in line with their values and what they view.
Unless you've worked at a hospital like Forest Park, you're going to find that there's a lot to learn, a lot to do, and a lot of rewarding experiences to be had here.
Well, we're here today at Forest Park Medical Center in Dallas, Texas, and they are the host site for the Texas Association for Bariatric Surgery's Patient Conference for 2013.
Today there is a fabulous patient-centric meeting. It's filled with psychologists, with dietitians, exercise physiologists, behavior modification people, but the whole goal is to take folks that have had bariatric surgery or are thinking about bariatric surgery and helping them to get fit, helping them to change the way they think, helping them to be successful with the whole bariatric weight loss program.
Today is very special because it's all about patients. At a lot of times professional meetings, it's doctors talking to each other, presenting their data. This is all for the patients to help them have a better outcome, understand what's going on in their bodies. My job will be to help them understand some of the psychological aspects of weight loss surgery and hopefully give them some coping strategies to maximize their success.
TABS is a great organization for speaking for the patient. So it's not only about surgery, it's about support, it's about exercise, it's about prevention.
It's very important when you take care of patients, whether they have diabetes or high blood pressure or they have a craniofacial deformity or even just have a gallbladder disease. We need to provide preoperative care, intraoperative and immediate postoperative care, but it doesn't end at that point when the patient leaves the hospital.
Programs like this help patients see ways to overcome stress, ways to change their behavior, so that they can be successful with changing their eating habits.
All of the surgeons here include a multidisciplinary approach. They're not just giving the surgery and sending the patient on her way. There's nutrition, there's a psychological component, there's support groups, and yeah, this is a world-class place.
You know, Forest Park was founded to give physicians an opportunity to take center stage in the care of their patients. It's not an institutionally driven care model, it's a physician-driven care model.
Best Docs Network featuring Forest Park Medical Center. Forest Park Medical Center, extraordinary in every way. Did you know at Forest Park Medical Center the patient ratio of care is typically 4-to-1, one nurse to every 4 patients versus the typical 5-to-1 or 6-to-1, which is characteristic in most hospitals.
Forest Park Medical Center San Antonio is your destination to better health. Now on to our next Forest Park doctor, thyroid specialist Dr. Kathleen Hands, who's going to tell us about a patient's experience with pregnancy and thyroid disease.
Everything kind of started when I felt a squishy lump underneath my jaw, and I was referred to an ear, nose, and throat specialist. There was no reason at all to go to a doctor for that, And in the end, it turned out to be a stage 4 cancer. So I've been carrying that for about 30 years without knowing.
Approximately January 2011, genetic testing had been developed so that these patients could actually get genetic tests on those nodules that is performed at the time of the actual biopsy. But if you're BRAF positive, those patients aren't typically sensitive to radioactive iodine, and it's not going to work in those individuals. So having that information prior to their surgery so they get the appropriate surgery, having that information prospectively so we know after surgery how are we going to treat those patients is vitally important.
One of the most important things that a BRAF positive person can do is get a very, very good surgeon to take out as much of the cancer as possible. That was why it was so vital for me to have a surgeon who was extremely capable and experienced, and that's what they did. They took out all of my thyroid and 66 lymph nodes. From the very beginning, when we walked in, till our relationship today, it's always been one of tremendous amount of compassion. All the little details that me, just as a person, would want, that's the kind of doctors that she's been for me. Just giving me the confidence and the care that I think she would give a family member is all I can, compare it to.
First, do no harm. We really want to get patients to get the right treatment, which can now be tailored to their specific genetics. We've never been able to do that before. In the last 2 years, that's been a very groundbreaking procedure for thyroid cancer.
Patrick has a question for Dr. Arnold DeLeon. What kind of activities can I do after having a spinal cord stimulator implanted?
Depending on what kind of spinal cord stimulator you had implanted, if it was a laminotomy lead versus the epidural leads, we usually ask patients for the first 4 to 6 weeks to kind of watch out for repetitive bending or moving, almost to kind of take it easy for 4 to 6 weeks. Usually after about 4 to 6 weeks, they can resume their normal activities. I've had some patients that go and ski every year and don't have a problem. I've had some patients that play sports and do other things like that. Knowing, however, there is a risk anytime you were to take a jar and fall or a hit or anything like that. But the idea behind the spinal cord stimulator is we're trying to get patients to become more active and to be able to be more active with less pain. So that's what it's designed for.
Thank you for tuning in to this week's episode of the Best Docs Network featuring Forest Park Medical Center here in San Antonio. Still curious about Forest Park Medical Center and its doctors? Check out our website, bestdocsnetwork.com, and click on that Forest Park Medical Center tab. Got questions or comments? Email us at info@bestdocsnetwork.com. So long, everybody, and we'll see you next week.